My name is Nelly Vega Munoz and my topic is cancer. Cancer is a name given to a collection of related diseases. In all types of cancer, some of the body cells begin to divide without stopping and spread into surrounding tissues. Cancer can start almost anywhere in the human body. Normally, human cells grow and divide to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells take their place. When cancer develops, however, this orderly process breaks down. As cells become more and more abnormal, or old or damaged cells survive when they should die, and new cells form when they are not needed. These extra cells can divide without stopping and may form growths called tumors. Most cancers are tumors, but others, like leukemias, generally do not form solid tumors. Sometimes, as cancerous tumors grow and invade nearby tissues, some cancer cells can break off and travel to distant places in the body through the blood or the lymph system and form new tumors far away from the original tumor. Cancer is a genetic disease and can be inherited from our parents. Cancer can also arise during a person's lifetime as a result of errors that occur as cells divide or because damages in the DNA caused by certain environmental exposures. Different cancers have different symptoms. The symptoms will depend on where the cancer is, how big it is, and how much it has invaded and affected an organ or tissue. If the cancer has metastasized, the symptoms may be more severe and may appear in different parts of the body. Even though there is a lot known about cancer and there's a lot of information out there, a cure hasn't been found for it, but it can be fought and treated. Most cancer can be cured, but there is always a possibility of it coming back.
Hi, I'm Becky Pedersen, and I'm going to talk about treatments under cancer treatments and symptoms. So, one of our first treatments that you deal with cancer is one of the most common ones are when you get surgery with anesthesia. Uh, and when you use surgery with anesthetics and stuff, it's usually used to keep people from the anesthesia is used to keep people from feeling the pain. When they cut out tumors and things. The surgery also works best for people with a solid tumor so that they can take out the whole thing at one time. When you have a softer tumor or something that can spread, it's usually not the best option because you'd have to get a lot of surgery to get those tumors taken out. Our next thing is chemotherapy. That's the one a lot of people hear about. Chemotherapy actually works the best by stopping or slowing the growth of a cancer cell. It also helps to treat cancer and to erase other cancer treatments. So you get chemotherapy to kind of get rid of other cancer treatments. You can also get chemotherapy to pretty much get rid of your cancer, and it works on a lot of different cancers. So it's one of the most common ones. Our next one is radiation therapy. Radiation therapy splits off into two different sections. It'll split off into external and then internal. External radiation therapy, it's a beam of radiation that comes from a machine, and they aim the radiation towards whatever cancer you're trying to get rid of. The external beam therapy usually treats a specific part of your body. For example, like if you have cancer in your lungs, it's going to treat that one specific area in your lungs. Internal is taken as a form of a pill or a sort of medicine, and it's going to get rid of different types or like different areas of cancer in your body. So it'll get rid of, if it's in your lungs, if it's in your liver, it'll take care of like all of those places. And it's usually in the form of capsule or forms of seeds or things like that. The next one is immunotherapy. And in this type of therapy, it's going to help your immune system to fight off the cancer that's already in your body. And it helps strengthen your immune system so that your immune system can kind of fight off the cancer without having these heavy sorts of treatments. It's definitely not as heavy as chemotherapy or radiation therapy. It just kind of helps your body naturally get rid of what's already in there. The last one that we have is targeted therapy. And this one, they use small molecule small molecule drugs, and they also use monocule. They also use monocular. This is just a hard word that I have never been able to say. Monocular. So on targeted therapies, the small molecule drugs, they're just drugs that go into a cancer cell and they can destroy the cell from the inside. And then the antibodies, they're drugs that they can't enter a cancer cell easily, but they can attach to the cancer cell and destroy it that way. They can destroy the cancer cell by attaching, and they can destroy the cell from the outside. Targeted therapy helps by helping the immune system destroy cells on its own, and it also helps to stop cancer cells from growing. Basically, when it comes to side effects, these side effects from the treatments, they vary from person to person, even if they are receiving the same treatment. Some people may have only a few side effects, while others have many and more severe ones. Many factors contribute to the side effects, including the type of treatment the person is receiving, the frequency of the treatment, and the person's age and other health issues. Common side effects of cancer include anemia, appetite loss, bleeding and bruising, constipation, delirium, fatigue, hair loss, and sleep problems.